Hi everyone, it's Dr. Dave and I am coming back to you this week with a medical minute. We are going to start this new series where people will ask me a question. I'm going to give them an answer. I say within a minute. It's always going to be longer, but the point is it will be a short and brief answer. Okay, so today I saw a patient who told me that they had a friend who had a stress test and then had a heart attack a week later. Now, I don't know the details of this case at all, but it had me thinking, how do heart attacks happen? And how can you have a stress test and still have a heart attack? A stress test that's normal and still have a heart attack? Well, the reason is very simple. You have to understand that most heart attacks, remember, a heart attack occurs every 40 seconds in this country. Most heart attacks do not occur from severe blockages. Most heart attacks occur from blockages that are moderate. And let me explain. So if you look at this artery right here, this is a model of an artery. This is a normal artery. And you can see right here, the inside of the artery here is smooth, okay? Smooth and pink, and that is what we were all born with. That lining is called the endothelium. Think of the endothelium as Teflon. It's smooth and it doesn't allow anything to stick. Okay, as we get older, we will all, 99% of us, as we get older, we'll develop some cholesterol. And that's part of the normal aging process, still not a major issue. However, some of us, as we become older, are going to develop blockages that are in the moderate range. This is a moderate blockage, okay? Now just remember, let me see if I can compare this. This is normal, okay? And this is moderate. This is the problem. This is where most heart attacks happen, from moderate blockages. Let's take it a step further. How about a severe blockage? Well, believe it or not, most heart attacks do not occur from severe blockages. They occur from moderate blockages. Why? Moderate blockages tend to be like cottage cheese. They are friable. They break off. And if they break off, they can cause the blood to clot. Blockages that are severe have been there for decades, a long time. So they become hard, calcified. They will cause symptoms, or they can cause symptoms, but they're not going to be the blockages that kill people, because believe it or not, the body tends to adapt to these blockages. It's these blockages that suddenly rupture, the moderate blockages that rupture, that can cause a heart attack. So here's the issue. What does a stress test pick up? A stress test will pick up this blockage, the severe blockage. However, the stress test will miss most moderate blockages. So how can we reconcile this? Well, what I talk about all the time is the coronary calcium score. We have a test that enables us to pick up disease at any level for the most part. There are exceptions. There are exceptions to everything. But the coronary calcium score will pick up, for the most part, this type of blockage. The coronary calcium score can pick up this type of blockage. Coronary calcium score will even pick up some of this and can tell us if there's really nothing or not much going on. So that's why I always tell my patients, stress tests are very good. They're very important in certain patients, but you should always consider pairing a stress test with a coronary calcium score. This is not for everyone. I am not giving medical advice. I am not giving medical treatment. I am asking you to be aware that the blockages that cause heart attacks may be missed with a stress test. And this is why you have to have a discussion with your doctor, your cardiologist. You need to ask, okay, you want a stress test. What are we looking for? Why not a coronary calcium score? Why not both? Many times we'll do both. We'll do a stress test, especially if patients are having symptoms, but we'll also do a coronary calcium score. So bring it up to your doctor. You can even tell them, Dr. Dave said, why not a calcium score? And let them give you a good reason as to why you don't need a coronary calcium score. Not everybody needs a coronary calcium score. If you have stents, if you have bypass, if you had a cardiac catheterization recently, you do not need a coronary calcium score. But that's not a lot of people. Most people, especially if they have risk factors and if they're over a certain age, should strongly consider getting a coronary calcium score. Okay, guys, that is this week's 1-minute medical consult. If you have any other questions or you want to talk about any other issues, feel free to text me. Until next time, this is Dr. Dave.